Oh, I know that sound. It's time for the Beer and News Report. Hi, and welcome to the Beer and News Report. Cheers. Today I'm drinking Dr. Juice. It's an IPA. It's a hazy IPA. Now, IPA stands for India Pale Ale, and hazy means that it's unfiltered, so it's not clear, as you can see from the beer. But if you've ever drank an IPA, then you know that it has a strong hoppy flavor. And I'm not a fan of hoppy flavor, so this one doesn't rank high on my list of beers. But for an IPA, it's not that bad. The hoppy flavor doesn't overwhelm you. So if you want to try an IPA for yourself for the first time, I recommend you try this one. Cheers. Well, I'm back. I was out for a whole month of September. I went back to see family in Vermont. And then October came and I had to write up some scripts and do some research. So finally I have some shows, but I'm still going to take Thanksgiving to New Year's off. So hopefully I get in another 4 shows this month. Now when I came back from Vermont, obviously friends came over to see how the trip was. They asked me how I'm doing. One of them told me that he was taking Ivermectin to prevent COVID. I was like, why are you doing that? And he said, well, his doctor... he has a heart condition. His doctor said that some of the vaccines give myocardia, which affects the heart. And so he was recommended not to take the vaccine, but he still wants to prevent COVID. And so he's using ivermectin as a prophylactis, meaning that it's going to stop you from getting the disease. So I was like, how did you even find this? And so he told me, he gave me all the websites that he went to and the doctors that he researched. So I did my own research on this. And I still wasn't going to make a show about it until another friend came up and she said that her friend was also taking ivermectin. I was like, wait a minute, has the world gone crazy? I mean, I've heard about it. You've heard about it. It's been in the news. But the CDC and the WHO say it's not for COVID. So what is ivermectin? What is it used for? Well, that's going to be the topic of today's show. So sit back, grab a beer, and let's talk drugs. Cheers. Before I get started, I want to say that I'm not instructing you to take ivermectin, especially if you're thinking of taking it over the vaccine. I got the Pfizer vaccine. I'm happy with it. I'm not taking ivermectin. In fact, I don't have any ivermectin pills in my house. This show is just an informational purpose. All right? Okay? Let's start the show. Ivermectin was discovered in 1975. It was put into medical use in 1981. In 2015, the scientists that discovered ivermectin, William Campbell and Satoshi Omura, received a Nobel Prize for it. Of course, back then there was no COVID, so what was it used for? It was used to treat parasites like head lice, scabies, river blindness, and other parasitic diseases. It works so well that the World Health Organization, the WHO, put it on their list of essential medicines. Now, has it been used in the United States? Yes, it is very popular in the U.S., and in 2018, it was prescribed over 100,000 times. Prescribed for humans, but you may have heard about it on the news as a horse dewormer. That's where the confusion starts. Yes, there is a veterinarian version of ivermectin. In fact, if you have a dog or cat, you've probably given him or her ivermectin. It's one of the main ingredients in the heartworm pills or to get rid of fleas. Okay, time out. I have to interrupt this show in case some of you viewers are thinking of going out there buying some dog heartworm pills to treat COVID. Don't do it. I am not recommending that. Humans are way different from dogs or cats, and these pills are not formulated for us correctly. The same goes for ivermectin pills given to horses or cows. Humans are around 200 to 300 pounds. Horses and cows are over 1,000 pounds. So to take a pill designed for them would most likely poison you. All right, so don't do it. Now, look at this chart. Ivermectin is dosed by weight, so a pill for you might not work for someone else. You really need to consult a doctor before taking this drug. Okay, getting back to the show. So why isn't ivermectin prescribed for COVID? All right, you're jumping the gun a little here, so let's take a break, have a drink, and think about how drugs are given the okay for human use. Cheers. Ivermectin has been around so long that it's now a generic drug. And what that means is that the patent on the drug has expired and anyone can make this drug. Now, ivermectin has been approved by the FDA for a number of parasitic infections, but COVID isn't a parasite, it's a virus. In fact, it is a new virus that we really don't know too much about. So think about how the COVID vaccine got discovered. The government threw billions of dollars at Big Pharma to develop it, and then in less than a year, a vaccine had been developed using mRNA technology. Now, it should be noted that mRNA technology was already in use. That's how we got the vaccine for Ebola. So this wasn't totally new technology. Also, when SARS hit China and the other Far East countries in 2003, that started the research on using spike technology for a vaccine. The problem was that SARS didn't hit the US that hard. So there was no urgency here to develop a vaccine. We helped with the research, but China discovered the genome for it. And so we had the starting block for the coronavirus already. And with this starting block, we could rapidly build off of it and develop a suitable vaccine in a short amount of time. It just had to pass the testing trials. Now, if you remember, tens of thousands of people were in these testing trials for the vaccines. That's for level 3 testing. Just so you know, level 1 testing is about a dozen people where you're trying to figure out what the dosage is to give people. And then you get to level 2, and that takes like a couple hundred people where you have 2 or 3 variations of the dosage and you want to see which one works the best. So by the time you get to level 3 testing, you get the dosaging down, and now you want to see if there's any complications from mass dosing. You have tens of thousands of people in that testing trial. And if you pass it, there's probably a good chance that the FDA will approve it. So, what testing has been done on ivermectin as a treatment for COVID? Dang, you're really asking some good questions. Cheers. So remember, I told you that ivermectin was a generic drug. Because of that, Big Pharma wants nothing to do with it. There's no money in it because anyone can make the drug. So if they can't exclusively make the drug, then they can't charge a lot of money, so they can't cover their expenses for all the testing. Now, this is a totally business decision, albeit an unethical one. That doesn't mean that there hasn't been any testing done. This chart shows that other COVID drugs have been approved with only one testing trial, but ivermectin has been tested 63 times. Look at the difference in the number of patients between ivermectin and these other ones. There's a huge gap. Ivermectin has been tested on tens of thousands of patients, blowing away the other drugs. And not only that, but it shows more improvement in treating COVID than the other drugs. So the data from this chart looks very promising, but the trials haven't been big enough to get the attention of the FDA. If you remember, level 3 testing needs a pool of thousands of patients. And I know you're saying, hey, look at that chart. It had 47,000 people tested. Yeah, that's true, but it was over 63 trials. So obviously a bunch of those trials were less than 1,000 people. In fact, I doubt if there was any trial over 10,000 people. So what we're really talking about is level 1 and level 2 testing. We haven't got to the big level 3 testing, which costs lots of money, and these small people doing the trials can't afford it. And so right now, I don't have a definitive answer for you, but I do know that people are taking it as a prophylaxis to COVID. Now, again, I just want to say prophylaxis means that it's intended to prevent the disease. I know I had to look it up too. Cheers. So where does this put us at? It is highly unlikely that Big Pharma in the US is going to do any testing trials or research on ivermectin. They can't make any money off it, which means we're going to have to rely on other countries or rogue billionaires who want to rock the system. Hey, did someone say Elon Musk? There's one thing that Big Pharma is doing, though. They're coming out with drugs similar to ivermectin at a much higher cost, right? Have you heard of remdesivir? It costs around $3,000 compared to ivermectin, which costs 25 cents a pill or maybe $1 a pill. And then there's a new drug from Merck called molnupiravir. And I doubt it will be cheap if it does get FDA approval. So it looks like to me that COVID is going to be around for a while, and it's going to be a big boon to Big Pharma. I'm hoping that more testing can be done on ivermectin and somehow the government gets behind it, but I'm not holding my breath. Now, before I go, I want to make it clear that I'm not suggesting, recommending, or promoting the use of ivermectin. I just want to point out that it seems like there's something nefarious going on with it. In no way do I want you to replace the vaccine with ivermectin. The vaccine helps prevent you from getting COVID, although if you do get it, it'll hopefully keep you out of the hospital. And while ivermectin helps treat people with COVID, right? So you already have it, you take ivermectin to get over COVID. It's a totally different use, and I do recommend getting the vaccine. Again, for the record, I got the Pfizer vaccine. I'm planning on getting the booster once I'm eligible. I'm not taking ivermectin for any reason, COVID or otherwise. So I just want to be clear with that. Are we all set? You clear? Okay, good. Cheers. Well, my beer is almost empty, and that means we're at the end of the show. If you want to contact me, I can be reached at this email address. I hope you had a good time watching the show, and I hope you raise some questions about ivermectin yourself and maybe you do some more research on it. If you like the show, please click the like button. Of course, if you want to get notified when I do a new show, click that subscribe button and then click the bell icon next to it. This will notify you when a new show has been posted. Until then, keep your beer cold and your inches hot. Cheers.